So the biggest roadblock to using blood-based biomarkers in clinical care right now is they're not reimbursed by payers. And if insurance won't pay for it, then patients are just not going to get it. We've certainly seen that with amyloid-PET, that if these tests, no matter how good they are, if they're not reimbursed, then patients will probably not receive them. But I think that just the data are going to be so compelling that these work, and the demand by patients to be tested, and the constraints of related to capacity for amyloid PET and CSF are just going to be so great that we're going to have to do this, and I think that payers are going to eventually have to pay for these tests. So that's the major roadblock right now. Of course, there's other issues to consider. How many of these tests can we perform? How quickly? Obviously, people all over the world may want these, and so how do we get tests to people in many different places? So there's all sorts of issues to consider. Actually, one issue that I think is going to be really important is that dementia specialists like me have been practicing a certain way for a long time. And the way we've been practicing is doing really just occasional biomarker testing on a few patients where we had a lot of uncertainty and we thought that the diagnosis would be really impacted by the results. And we're going to have to really change the way we think about our whole diagnostic pathway. And that's changing clinical care is very difficult. Because some doctors have been practicing the same way for decades, and we're really going to have to change what we do, both in terms of the diagnostic process and then in terms of the treatment pathway, because some patients are going to get these drugs. And how do we monitor them for safety? What do we do when they have problems? When do we decide to stop the drug? These are all huge things that are going to be coming up in the next few years that we're going to have to deal with. So it's a really transformative, exciting time, but it's going to be a lot of work to figure out all these different aspects of what we need to do for clinical care.